So liquid biopsy, of course, is something that is being investigated in solid tumors as well as lymphomas in general. And we're exploring liquid biopsies in primary CNS lymphomas as well. What is hard in primary CNS lymphoma is that these tumors are quite rare, and the majority of tumors are located deep in the brain. That can make brain biopsies quite challenging. And of course, if patients are seen in centers that have the expert neurosurgical techniques available, then biopsies are possible, but this is quite challenging in general as such. Additionally, even in expert centers like ours, we do see often patients that have areas of the brain that cannot be accessed from a safety standpoint without for the patients having to undergo severe neurologic deficits, which can be permanent. As a result of this, liquid biopsy is something that we and others are looking into. And here we're looking to see if we can make the diagnosis of lymphoma in the nervous system by having access to cerebrospinal fluid, which could be a surrogate of a brain biopsy. We are also investigating the use of blood and to be able to determine if primary CNS lymphoma can be diagnosed in that way as well. This is quite preliminary in terms of making the diagnosis. As you know, in oncology and as a cancer expert, we like to know everything there is in terms of the genomics of the tumor. So that we don't make errors in understanding our patients. But this is something that I believe with further enhancement of techniques, which are definitely occurring, that this will be quite helpful for our patient population. The second part, in terms of monitoring, this is extremely essential. So primary CNS lymphoma, by definition standpoints, of course, is a primary. That means that the disease is restricted to the nervous system and that it doesn't occur in the rest of the body. But importantly, the nervous system encompasses the brain, the spinal cord, cerebrospinal fluid, and the eyes. So basically, this tumor could be anywhere in any of these parts of the nervous system. Right now, what we use to assess response is imaging with MRI, where we're just basically measuring the tumor that picks up contrast. And then we're evaluating cerebrospinal fluid by putting it through basic cytology and flow cytometry. And then we have an ophthalmologist evaluate the eye, and this is a clinical evaluation, of course. So as you can imagine, we could miss microscopic disease here. There are some times, especially in brain tumors, where we would see some areas of enhancement, but unless we ended up going and having a biopsy there, we wouldn't know whether there's any true residual disease, or is this just a scar from a prior surgery or prior bleeding in the brain. And so these are all various reasons to explore the role of liquid biopsy in terms of really understanding how well our treatments are working, and also to know if we see any persistence of these ctDNA, does that mean these patients will progress more quickly than in those that we don't see this.